Very good morning to you. If you're just joining us, let's take you to the Eastern Cape. That province has the second highest number of COVID-19 cases with almost 6,000 infections. It's also recorded over 100 deaths and more than 2,600 recoveries. Well, the provincial government says gatherings and funerals are the main challenges. Eastern Cape Premier Oscar Mabuyane joins us now via Skype to talk about these and other issues. Oscar Mabuyane, thank you very much for your time. Premier, the province of the Eastern Cape has a problem with COVID-19 infections, but it appears that people, particularly youngsters, are behaving as though the lockdown is over. A house party in King Williamstown was the talk of the town this weekend.
Good morning, Colin. Good morning to Danton as well. Very unfortunate scene, embarrassing. I must indicate under a very difficult situation that we are in as a province. Majority of our people do acknowledge, do really appreciate that the coronavirus is around, and we feel it is quite palpable. But we still have such few recalcitrant groupings or individuals, especially that grouping that we have seen of young people. It's very unfortunate. We have been saying this, that this situation we are in calls for socio-cultural behavior, but it needs every individual to take responsibility to protect him or herself, protect the family, for the society to be protected. So clearly, we still do have a few elements out there that are really not prepared to be law-abiding. But as you have seen, police are cracking that.
What about funerals, Premier? And while you answer me on the issue of funerals, is alcohol going to present a major headache for you? Because those young people found it possible to gather for a house party because there was alcohol available.
Alcohol is a problem. Generally, and in our command council as a province, we said we probably must go back to national and lobby to really close down this problem of alcohol. We can't be a country that celebrates liquor in the manner in which we have seen people demonstrating, singing. It is very unfortunate that we can even think that we can grow our economy through the alcohol and all those kind of issues. That's very unfortunate. I think it gives us a major problem, the issue of alcohol. As we have indicated that even in funerals, in these days, as you know, even in funerals, you still have some people who are drinking alcohol while the funeral is continuing on the other side. Yes, funeral remain a source of a problem in terms of the infections, even though our numbers were limited to 50, and generally the society and our people have really been complying with the number 50, but the 50 is still huge. If one person is carrying the virus in that funeral and is able to transmit it to other people, it moves like that. So we still have a challenge around that, and we still wanted to plea and make that special plea to our people to remain at home. You can go back and visit the family at a later stage. At least the very close, next of kin, close family. That must be with the funeral. And most people have been doing this funeral nicely at 6 a.m. in the morning, at 7, 8 a.m. funerals are down. We've seen a lot of that improvement from our society.
All right, Premier, I'm going to have to hurry us along. In your next few answers, please be very brief, I ask. The other issue then, Premier, becomes the management of the coronavirus. The Minister of Health raising very key issues as he plans to return to your province later this week. He points out the issue of healthcare workers who are increasingly getting infected. He says that as of Saturday, the number of them that are infected both in public and private hospitals, that number stands at 258, and with about 14 of them having died. What are you doing to try and stop the spread?
It's a very unfortunate situation, and unfortunately we can't go to this war without our doctors and nurses. And as government, this is what we have said from the start when there was an issue about PPE. that we really make the call even to our nurses not to really risk themselves, but we've addressed these kind of problems. And most of these cases that we're talking about are not cases that our nurses are getting from hospitals. They are not infected at work. Some are bringing this infection from outside, from the society, from the funeral into the hospital. So that has been a major problem. That talks to the very same behavior of our people. That our people.
Premier, can I interrupt you there for a second? I'm sorry to cut in, but the unions, especially healthcare unions, are going to have a problem with you because they are suggesting that these infections are happening inside hospitals. As I speak to you, there is a hospital called the Life St. Dominic's that has had nurses come out to talk to us anonymously to say the hospital is not taking precautionary measures and this is a private healthcare institution. What are you doing to try and inspect these institutions?
We have really activated our team. That's the private hospitals, and I must say that we haven't really do much. We've been working with them, really trusting them, but since that we've seen at St. Mary's and as part of the Life group, as well as the St. Dominic's in East London, we have since activated our team. The department is working on that to get it to the bottom of the allegations that are out there. And we've seen some serious major allegations coming up on how those hospitals are conducting themselves towards this issue of COVID-19. We've seen a lot of patients being discharged back to the communities without following any proper protocol.
And that's exactly the problem, Premier. I'm sorry to cut in again. That's exactly the same problem. Now, you already have a case study here, if you like, and that is next door to you, KwaZulu-Natal. They dealt decisively with private healthcare institutions by shutting them down. Is that the same route that you're going to take with these few elements?
Definitely, but what we have said that we must seek the truth from facts. That's why the department from last week on Wednesday and Thursday, since the visit of the National Portfolio Committee, which was refused an entry in the hospitals, we started becoming alerted on that day that there's something that is not going right. We've got a team that is working on that. Soon we'll be getting that report. We have made that very clear. We are the authority as government. We are the people who are issuing licenses to these private hospitals. So if they can't comply with the conditions of their licenses, we are going to withdraw licenses and shut the hospitals down. We've made that one very clear to them.
All right. Final question to you, Premier. The schools are reopening today. My calculations tell me that there's about 404 schools that are not ready because infrastructure is simply non-existent. And I'm talking about water and sanitation. That then brings in the question of scholar transport, because pupils whose schools are not opening are going to have to go to nearby schools, and that means long-distance travel for those pupils, Premier. Is your scholar transport system up to scratch?
Yes, our scholar transport system is up to scratch. We got that latest report in our expanded Provincial Council meeting yesterday from the MEC. But also the records that we have is that more than 3,000 schools are ready to open today. It's only about 150 schools that are not. Some of them is a problem of PPE, which was delayed in terms of being supplied to those schools for students as well as teachers. That work is being done now to ensure that by mid this week, all those schools are being attended. Yes, of course, we are coming from a low social infrastructure basis as the Eastern Cape. We still have a lot of mud schools and a number of areas that we are working on as government through our program we called ASIDI to eradicate those mud schools. But the work is being done to ensure that we are fully compliant with the regulations set up for the school opening, and we don't want to take any chances. No schools are going to be open if there are no PPE, if there's non-compliance with the regulations with regard to COVID-19. We want to protect lives, protect our kids, protect our teachers as well.
Eastern Cape Premier Oscar Mabuyane, thank you very much for your time.